The title of my leadership project is the Efficacy and Utilization of C-ESDM Strategies Used by Parents and Caregivers in Low Resource Areas. Again, I'm Jazmin Burns, and I'm a LEND full-time postdoctoral scholar fellow. Here's my HRSA disclaimer. So I wanted to begin with just a little bit of background. So research has shown that toddlers and young children with or who are at risk for ASDs who receive early intervention services can benefit in many different ways. Some of these ways include reduced intellectual impairment, improved social communication, and improved language development. And this is very important to understand. Social skills interventions that include parents as the agents of delivery have been shown to be particularly effective. And again, this has been supported by research. So much so to the point that early intervention services delivered through Part C of the IDEA, which is the Individuals with Disabilities in Education Act, are now required to use a family-centered approach. And for those who don't know what Part C is, it's the Program for Infants and Toddlers with Disabilities, and that's a federal grant program that assists states in operating a statewide program for early intervention services for kiddos birth to 2. However, there are some problems. So the utilization of these research-based intervention approaches are limited in practice. Some of those reasons for the limitations include that they're costly, or they involve like time-intensive training for providers. Sometimes there's long distances to travel for training sites. The family's not always able to access these intervention approaches, and many of these models don't fit the early intervention system delivery models. So we wanted to explore how C-ESDM could kind of combat some of those limitations. So the purpose of this study was to do just that, and was to look at the effectiveness and the utilization of parent-implemented interventions after they were coached by C-ESDM early intervention providers in low-resource areas. And the low-resource areas part is key because a lot of families who are in those areas typically have a lack of education or poor education regarding resources and services that are available to them, as well as it's really hard for them to typically travel to hospitals or clinics and things like that. And so in this study, the early intervention providers were in home. So what is C-ESDM? It stands for Community Early Start Denver Model. It is an evidence-based naturalistic development behavioral intervention, or an NDBI. And ESDM is a behavioral therapy for children with autism between the ages of 12 and 48 months. And the community-specific element brings in the brief online modules for parents and includes training for early intervention providers. So the objective again of this study was to compare the Fidelity scores of parents who were coached by C-ESDM EI providers to the control group. And we hypothesized that the parents who were coached by the intervention group would demonstrate higher Fidelity scores compared to the control group, or the families coached by non-ESDM EI providers. So in terms of the methods, we had Part C agencies across 4 states, so California, Alabama, Pennsylvania, and Colorado, and there were 32 agencies enrolled in the study overall. And they were randomized into one of 2 groups, either the C-ESDM group, which is the intervention group. And I just want to note that that group for the C-ESDM was adapted to fit the early intervention delivery model, so like lower intensity, less hours per week for the parent-child dyad, and then the control group. So for the intervention group, again, that's the C-ESDM group, the providers were trained, and so they received up to 13 sessions with a certified ESDM trainer, as well as a parent coach. They received session feedback, as well as parent coaching Fidelity feedback. And they received that training over the span of 12 weeks. They also had access to weekly webinars, bi-monthly conferences with their trainer. And again, the feedback that they received was from the in-home sessions, which they recorded. Now, the parents who were in this group had access to the online ESDM modules, which is, as you can see in the pictures, the help is in your hand. Now, for the control group, the providers received 6 telehealth trainings with a UC Davis developmental psychologist. They also received feedback on their recorded sessions. However, they did not receive parent coaching training. And the parents in the control group received access to the online modules related to developmental milestones on the website All About Young Children. And I also want to note, at the end of the study, all parents ended up having access to all of the online modules for both Help is in Your Hands and All About Young Children. So we had 34 families overall, and in terms of the demographics, here's the breakdown. We had a majority male in terms of the gender of the child. And we had in terms of the race of the child, it was mostly Caucasian with a good number of African-American children as well. Regarding the mother's education, a majority of the moms had a high school degree and some college education. And in terms of their household income, a majority of the families fell in the low income bracket. So that's about $20,000 to a little under $45,000. And so again, for the purposes of this study, we were interested in parent fidelity. So how did we accomplish this? We had to do a lot of coding. And this is what we used this sheet, the ESDM fidelity score sheet, to code. And so there are 13 ESDM fidelity items, and they're all listed there. And so the way that the coding worked was that there were 2 of us. It was Elizabeth Fuller and I know Sally Rogers helped with some of the coding at the beginning as well. And we would look at 2 different activities. Some were object play, so that's, things with books and toys and things like that, or a sensory social routine, or an SSR. And that's more like dancing and singing and, bubbles, things like that. And so Elizabeth and I would look at a recorded activity, and we would have to code all 13 items for the one activity. So like in this picture, if we saw a mom blowing bubbles with her kiddo, we would code all the items for that activity. The activities had to be at least 1 minute and across just one parent, but there were some times where it had to be across 2 parents, or the activity was less than 1 minute. And in those instances, we just coded to the best of our ability. These highlighted items here just illustrates that these were the items that parents showed the most change over time in terms of their fidelity scores. At time 1, as you can see, the control and intervention group came in about the same in terms of their fidelity score. They had about a little over a 3. For those who aren't aware of, this is a box and whisker plot. So the way to read it is that the black line in the blue box is the median. The tails or the whiskers are the minimum and maximum of the range. The lower box is the 25th quartile, and the upper box is the 75th quartile. So from time 1 to time 3, as you can see, the intervention group did slightly better over time. And as you can see, like the little circles, those are just outliers. So those are parents who were either below or above the minimum and maximum. And so as the regression table shows, model 1 is our base model, and model 2 is really showing the change. So we have our intervention group, which again is the C-ESDM group. They did about 0.5 points better than the control group, and this was found to be statistically significant. And so parents who were coached by the providers who were trained in C-ESDM, again, received upwards of 0.5 points higher on their fidelity scores compared to the control group. So overall, this pilot showed great promise, so that's wonderful. So in terms of next steps, we're hoping to do this study on a larger scale to see if the findings are similar. And we're also wanting providers and parents to watch the Help is in Your Hand videos together, because we found that when they were told to do it on their own, parents didn't always watch those videos. And I just want to say thank you so much to my mentors, Aubin and Sally. They've been wonderful this year, as well as my teammates, my collaborators, Elizabeth and Megan.